It's day 3, and while we've talked a lot about side effects, I want to take a look at the second biggest barrier to vaccination: the perception vaccines were rushed onto the market. Our survey indicates that 58% of unvaccinated adults think there was not enough research carried out, and 55% think that they were developed too quickly. I want to address this head on, and so I'm taking them to meet some of the scientists who've tested and trialled the vaccines. But not everyone is on board.
Vicky doesn't want to come with us to Bristol, which I understand. She feels frustrated in the same way that I do. One thing I'm a bit disappointed about is that because Naz and Vicky are so entrenched in their beliefs, they're sort of immediately shutting down any type of conversation that they don't agree with. And it means that people are not being given room to ask the questions that they want to ask.
Vicky and Nazarene are staying behind.
Next
The
to do.
rest are splitting into 2 groups. I'm heading to Bristol with Luca, Ethan and Mark to meet Professor Adam Finn, who's been instrumental in COVID-19 vaccine research. It's a chance to get to know Luca, who out of the group posts the most extreme views on social media.
Luca, on your Twitter feed...
Did you stalk my Twitter?
Of course. Did you stalk me?
No, I stalked your Instagram.
Oh, there you go.
So I've posted something about a microchip being in the vaccine. You don't know these days, do you? Because we've been lied to. No one knows what's actually in that vaccine, do they?
Our survey indicates that 5% of unvaccinated adults also believe that there's a microchip.
I bet there is a microchip in there too. Oh, God. It's like, if I'm sure if Bill Gates could have gotten a microchip in there and Klaus Schwab could have got a microchip in there, why not? I mean, they might have not developed one that is good enough yet, but I don't see why they wouldn't. But that seems like such a... I mean, I've seen things on the BBC where they're openly talking about that the next thing is going to be microchips. So it's like... They say that on the news, and then they gaslight you by saying 5% believe there's a microchip. Like that is a conspiracy theory. But then on the next news bulletin, that's actually talking about microchips.
The vaccine.
I'm banned from Facebook again for 30 days. I think the vaccine was put on this world to depopulate, the world and get the population down. And unfortunately, it's actually killing a lot of people. You can see all these healthy athletes dropping dead every day. With heart attacks, problems, young kids, passing out of school and dying. It's from the jab. I've noticed there's quite a few 5G towers that have been popping up quite a lot. I think once they switch them on, there's going to be more deaths.
Luca.
Yeah, I mean, I agree with most of the stuff he's saying there. Yeah, it's all like I'm not 100% on all of it, but I'm more, more or less the things that he's saying. I resonate with what he's saying, but they kind of characterized him as this guy in a scooter. He's a bit weird, skinny looking, sort of a 40-year-old virgin type character. I think he's probably a genuine guy though, but sometimes I think the documentary will use that a bit to make someone look a certain way.
On his own. In Tunbridge Wells.
Lives on his own.
I feel there's a divide as well between unvaccinated and vaccinated. I think my next boyfriend, I want him to be unvaccinated, but it ain't gonna happen.
A lot of these views of Luca's are misinformation, based on rumour, not fact. I'm
Naturally.
hoping that the visit today will lead him to question what he's been sharing.
Medical misinformation.
Do you want to grab a mask, Luca?
I'm not wearing it though.
You don't want to wear it?
No,
I think we might have to, though.
but I'm exempt.
Yep.
Having led clinical trials for Oxford AstraZeneca, Janssen and the newest vaccine, Valneva, Professor Finn is an expert in how vaccines work.
The COVID vaccines we've got at the moment are very good at protecting you from getting seriously ill, but they're not really very good at stopping you from passing the infection on to other people. When you encounter an infection, a foreign microbe or a vaccine, you make an immune response to that particular thing. And one of the really important parts of the immune response are called antibodies. These are proteins that your white blood cells make.
With COVID, antibodies are a key part in helping your body fight off the virus.
So that's what we're going to do today, is going to show you how we measure antibodies in saliva and spit from people who've had the vaccine before and after.
Okay, so you have a look. Yeah, absolutely.
Okay, then you can begin.
We've got 2 samples from different people. One sample before they had the vaccine and one after. The colour change will tell us how they're responding to the virus.
Yeah, I mean, I don't know what's going on here, but you know, I just don't really care. You know, like it doesn't matter what scientist that they always get, like, they'll get a scientist on and he's probably not lying, but he's like, yeah, look, here we go. I'm going to show you something that proves that everything that happened over the past 2 years, it was right. And then you're supposed to just be like, okay. I guess you just prove that everything, you know, that just totalitarianism is okay. Thanks for telling me that. I that's why I don't like the way that they just try and science you to death. It's like the science. We're gonna go to the science. This guy in a nice white and blue coat is gonna just sort the science out for you, and I won't understand what they're talking about really. And I don't know whether he's bullshitting or whether he's unconsciously bullshitting or whether he's kind of telling the truth, but I just don't really care what a scientist has to say at this point.
There's a lot of antibody, you'll see a big colour change, and if there's no antibody, there won't be any colour change at all. And actually, there's already some colour change coming through, because that's how fast antibodies bind.
That's so quick, isn't it?
What we see consistently with people who get vaccine is that you go from having no antibodies, unless you've already had the infection before, and you go to having a lot of antibodies.
So I wanted to know the risk of somebody who's had COVID twice compared to that of somebody who's been vaccinated.
Sure. We think that the immunity you get is more consistent and usually stronger if you've had the vaccine than if you've had the infection, unless you've got the infection really badly. What we are finding, though, is people who have had vaccine and then get the infection, they get a very strong immune response.
I've seen the UK column was saying things like basically the opposite about people who were taking the vaccine. They were saying, so I mean, that it's a bit like, I've been talking to different people about, you know, Bitcoin, and I don't understand Bitcoin either, because it's like one person will be like, oh no, you've got to do it this way, and I'm like, are you sure? And I don't understand it, Bitcoin, yet. So then somebody else will say, oh no, you want to do it this way, like a complete opposite way. And it's just, you don't know, like, both of them like seem like they're right, but you don't know because you don't understand the subject. So I don't understand stuff to do with infections and stuff. So I do look to authority to kind of tell me what to think in some cases. But yeah, I don't think he really believes what he is saying when he was talking.
The problem is that we don't know what will happen next. If they go on being mild variants coming through, then that's fine. But if we've got another more virulent one, then that would be a problem. So the future's a bit uncertain.
I want to hear more from Professor Finn, so we're taking the discussion outside.
What I'd really like to ask is, this vaccine was created and for distribution quite quickly compared to others. I think there's a bit of a fear there that how was that done so fast and passed through legislation?
Yeah, it's a really important question, and it's a really relevant one, because the speed with which these vaccines were developed is unprecedented. The way it was done was not by missing out steps that we normally do. It was by taking an enormous financial risk.
One academic that I spoke to said that it was also because of bureaucracy, really, that normally someone wants to schedule a meeting and they're like, oh, I can see you in 3 months. Whereas in this situation, the urgency was so ever-present that people just got rid of anything else that was in their diary, and this was the priority.
What's actually in the vaccine?
The vaccines that we're using...
I don't think that, so she makes it sound like, because it was like, and the fear was really intense around that time, April 2020, but she's just like, yeah, because of all that was a good thing that the government jumped up all that fear, because then that meant that all the scientists could clear their diaries and just get on with making these vaccines. And I just don't get the sense that that's truly what happened. I didn't get that feeling off of it. It seemed like it was all prepared and all planned, and this has all been just one big scam, like hoax, right from the beginning.
In this country at the moment are quite different from the vaccines that we've used in the past. We were able to get the code for this spike protein on the virus within a matter of weeks from China. And that code was enough to make the spike protein.
Put simply, the mRNA vaccine enables your body to make its own copies of the spike protein. which in turn kickstarts the immune system into creating the antibodies you need to fight the virus.
Well, it doesn't seem to be working very well so far, does it? Because it seems like people who have taken the vaccine have just as much COVID as people who haven't, sometimes more. So they're talking about fighting the virus. And it's like the elephant in the living room that people are just ignoring because people just say, well, that's a conspiracy theory if you believe that's true, but it is true, isn't it? People are just, they're triple jabbed and then they get COVID. I heard Julia Hartley-Brewer say that on her show the other day.
You know, what are the pharmaceutical companies getting out of this? You know, they produce this vaccine, you know, they're making a lot of money.
AstraZeneca, who went into partnership with the University of Oxford, were persuaded by Oxford to make no profit on the vaccine until the pandemic was over. And so they've essentially been selling their vaccine at a very low cost. The American companies like Moderna and Pfizer have taken a very different approach, and they've seen this as a bonanza. I mean, they've made an absolute fortune out of making these vaccines, but we've all kind of jointly made the decision that capitalism is the way we want to go. People like me...
Capitalism is the way we want to go. I thought he was going to say health is the way we want to go, and that's why they did it. I don't think they did that because of health. I think you would have been better off taking the money and spending it on like green vegetable juice for everybody and like clean water and stuff. Or, you know, I just don't know why people are just so in love with vaccines. I can only imagine it's because of the propaganda. It's just like, with all the things you need to fix in your life, why are we so obsessed with trying to do it through a needle? Not even sure that works.
People like the regulatory authorities exist as a kind of buffer in between them and the public. And if results come out that companies might not like the look of, it's my job to publish them and make sure that everyone knows what's going on.
I wonder if meeting Professor Finn face-to-face has had any impact on the group.
Did it clear stuff up for you?
Yeah, it did. Obviously, you know, what was actually in the vaccine, and also, you know, the pharmaceutical companies, you know, what they're making out of it.
And did you buy his explanation?
Yeah, I did, but I still wouldn't have the vaccine.
While we've been in Bristol, Chanel and Naomi are making their way to the St George's Vaccine Institute in London to find out how the COVID vaccine affects pregnancy.
I chose not to get the vaccine prior to the pregnancy, and that was also about fertility. I'm an older girl having a baby, and so I didn't want anything to infringe on that before we got pregnant.
So for me, that's why I've not chose to be vaccinated as well at the moment. You know, I would love children, and I just don't want to do anything that's gonna like jeopardize it.
Chanel is worried about the vaccine's safety. Perhaps it's no coincidence that she's from Lambeth in South London, which until recently had one of the lowest vaccination rates in the UK.
As a minority group, we have been always seen as less than. My other half, he's a lot more hardline when it comes to the vaccine. And when we got pregnant, that was a conversation that we both had to have. There are complications, there are vaccine health issues and deaths. So I think I need to do a little bit more research. I need to get more information about it. Thank you so much for your help today. Thank you.
Naomi and Chanel are here to meet Professor Khalil and volunteer Valentina to hear about the latest results from one of the largest vaccine and pregnancy trials in the UK.
Hello. Hi there. Hiya.
Chanel caught COVID when she was 21 weeks pregnant.
I was absolutely petrified when I caught COVID and was pregnant. And even now, I'm still going to be looking at my babies and milestones and thinking, did that have anything to do with the COVID that I had at the beginning of the year?
It's normal and it's common for pregnant women to feel very protective of their babies. But what we know for sure, the vaccine does not cause miscarriage. We know that the vaccine does not increase.
So that lady was saying that she had COVID. But now she's also has concerns about the vaccines.
Chance of stillbirth. So we really have good safety data from a very large number of pregnant women who actually receive the vaccine.
And that's just in the UK?
Not just in the UK. So most of the data that we have are from the United States, from the UK, from Canada, from Israel.
And they all align with each other? They all basically say the same thing?
There's been no concern so far. What's new that actually is potentially the vaccine is actually useful for you and for the baby.
I mean, I was half agreeing with her as like she was telling the truth, and now she's saying it's actually useful. That you inject it and it actually gets some benefit. I don't think that's true. But they make these extraordinary claims, don't they? These people in authority, just because they're probably told to say by their higher ups. So they speak with authority, but it doesn't mean that they actually. What they say is the full truth. They've got just as much credibility as anybody else here. You shouldn't look up to them just because they've got a nice, job title and a nice outfit. They're just indoctrinated into thinking that this is more or less the truth.
Most recent data tells us that the vaccine could reduce the risk of stillbirths by about 15%.
The vaccine could actually, prevent stillbirth now. So this is the vaccine isn't. There's a new thing that we didn't know about the vaccine. Actually, it's going to help you now with avoiding stillbirths.
Get the vaccine.
That is a number that is worth repeating. If you catch COVID while pregnant, your risk of losing the baby to stillbirth is 15% lower if you've had the vaccine.
I'm going to be very honest. I am
I don't think so.
not convinced.
No.
I really want to get down to the crux as to why you would maybe do it's a trial, isn't it?
I can understand that you feel really protective. I mean, I am the same. I'm 32 weeks, so I am the same. You just need to step back and think, okay, that's what I'm feeling about it. So go into or try to see where are the right information.
Braver than me.
Actually, what we found is that the vaccine giving the pregnant woman prevents hospitalization because of COVID in the infant for the first 6 months of age.
What? She's making these extraordinary claims, like this Italian-looking lady, isn't she?
For Chanel, it's never been just about the COVID vaccine. There are some appalling statistics about the healthcare of black women in the UK.
We are 4 times more likely to die in childbirth because our voices are not being heard. So what do I need to do? Do I need to scream loud? Do you understand what I'm saying? So I need to get over that stuff first before I even think about COVID. What I'm being told is just what's good for me, not what has happened in the past and how can we alleviate some of these issues.
Look, I think it's important to acknowledge what happened in the past. It's our duty to reach out to you and to your community. And actually, we'd really love your help in how to actually engage with black women, black pregnant women. We want the best for you and for the baby.
It is definitely something to think about in terms of, getting, some other black women together. I'd be happy to work with you and collaborate on that because I think that is so important.
Thank you very much.
Oh, yes.
Not sure what they're collaborating on there. I missed that. But going to do a collaboration.
A lot of information circulating in my head right now.
Yeah, a lot of information, but do I need to form something in my community where I can go out there or do some outreach projects myself and get that sorted out?
So much of the conversation around the vaccine comes down to a question of trust. This has always been central to Chanel's concerns. And she's not alone. Our survey suggests that when it comes to COVID vaccines, 22% of us have very little trust in our government, and a further 19% don't trust them at all. I suspect Vicky and Naz are part of this 19%, and I really want to understand what's at the heart of their concerns. But first, I want to find out why they didn't want to come today.
Slow it down for this bit. It's a bit more interesting.
I chose not to come today because I've listened to researchers and doctors on the side of why you should take the vaccine, and I've listened to medical professionals who are saying that these are the reasons why you should not take this vaccine, so I don't think I would have gained anything new from this experience today.
We felt that we can't actually openly, as adults, have an informed conversation with you about the statistics and the facts that we're talking about. All of the data our government made the decisions on, whether it was that we locked down children, whether it was they were forced to wear masks, whether it was that we were testing them constantly, they made all of those decisions about our lives, our freedom. There's so many things that I could say to you. It's so frustrating.
Yeah, I get a frustration because it's like they're keeping this discussion gets kept in a box, which is basically all about the vaccine. But the discussion is much bigger than that. It's just like, why has this all been happening over the past 2 years? Why are they so? why are they like pushing forward with this like a sort of steamroller? Why have they did it so? Why is it all happening? That's what frustrates like people on her side is like they don't. That's never seem to be addressed, and then she'll like reply with some.
That you are very passionate about everything that's happened over the last 2 years. You want to have the conversation about data and statistics. I want to have that conversation too. So that's why I thought that we could sit down and have this chat.
I think the most impacting and the most interesting for us to talk about right now would be trials. I want to talk about trials.
Yeah.
Is this an approved drug in the same way that when I take a paracetamol?
Yes.
Well, now, it's exactly the same,
Hang on,
completely
hang on.
approved and not under emergency protocol.
Hold on. I can't just chase you around.
No, I'm really sorry.
There are different versions of the vaccine. It's possible for one version to be approved, while simultaneously companies and the researchers are running clinical trials for subsequent versions. So
Okay.
those two things are not in conflict with one another.
Okay.
So every time that you get an adaptation to the vaccine, you have to go back through the whole process and demonstrate not just that it works, but that it's safe.
Vicky is right in some ways. The vaccines do indeed go on to phase 4 trials after approval, but this is normal. Phase 4 trials are the ongoing surveillance of the drug after rollout.
It looks like the last 2 years has affected both of them very deeply, and they're really, they know people who have really had a really terrible time and they're upset about it. You can't really have a proper rebuttal about that.
Yeah. Because
I'm really starting to realise that the problem here isn't so much about a lack of information as it is about this ocean of misinformation that is incredibly hard to wade through.
Alongside more subtle forms of misinformation, there have also been some serious online vaccine hoaxes. Researchers have found that just 12 people are responsible for the majority of them. That is a tiny group dedicated to spreading misinformation that grossly misrepresents research.
Just to give you...
I'm not so sure about what she's saying there, because I think there's not only do I think there is a lot of disinformation, misinformation coming from the government all the time, but they also censor people who post alternative views, and they call it medical misinformation. So yeah, that's a typical argument that they'll say that it's all anti-vaccine misinformation. Well, I don't think so.
For example, here's something I found on social media. This is, on the surface, it looks like a standard NHS consent form. And this, by the way, was sent around to schools. So you have to imagine parents of small children reading this. I mean, it looks completely legitimate. Sign here and take the vaccine. And when you dig into it, it says that there is a 1 in 29,000 chance of dying from the vaccine. Now, it's my job to look into numbers like this. And I can tell you, as an absolute fact, this is complete nonsense. The question is, how do you tell? When you see things like this, how do you possibly distinguish fact from fiction?
Well, I mean, yeah, so it's trying to say that, it's like this very small group of anti-vaxxers are putting out this misinformation and they're the problem. However much that group might spread a bit of disinformation here and there, who spreads more disinformation and who has a bigger budget more than the government? So they never reflect the mirror back on themselves, and they say, look what the government did. Look what all those dark psychologists did in the behavioural insights team. Look what they did with the fear. They're trying to say that it's happening the other way. So everything's like an inversion.
This letter, believed to be written by people wanting to disrupt the vaccine rollout, was unwittingly sent out by a number of schools, not realising that it was an anti-vax hoax. It's no surprise that people no longer know who to believe. Our survey indicates that in relation to COVID-19...
I wouldn't be surprised if the government sent that out and that was a little hoax of its own.
Over 30% of the population have very little trust in mainstream news, and that includes the BBC, Channel 4, Sky and ITV.
Good afternoon, everyone.
Hi. To talk about the growing phenomenon of misinformation, I wanted to meet Will Moy. He founded the charity Full Fact 14 years ago.
Oh,
Their aim
God.
is to fact check everyone from politicians to bloggers and the mainstream media. I know something that came up quite a lot in all of our conversations is about posts being taken down as misinformation. So I thought I'd bring Will along to talk to us. So Will, tell us about full facts.
We set up trying to keep politicians and journalists honest. So most of the time, what we're doing is tackling people like Boris Johnson and Keir Starmer, things they might be saying to you, trying to get elected or whatever. So this is one of my favourite ever fact checks. Golf can reduce your risk of early death. So these people have done a study, and they basically looked at golfers, and they worked out that golfers tend to live longer. What they haven't taken account of was what other exercise people do, or how rich people are. Golfers are richer than other people. So they've missed out two massive factors that determine your risk of early death. And so although there was a sort of credible looking study behind it, actually the claim just doesn't track it.
It's a really interesting example of correlation and causation, is what the statisticians call it. But essentially, it's
So we get to the correlation causation argument now they're doing.
the people who play golf live longer. It's that people who live longer play golf. You see what I mean?
So this is a picture that was circulated online, and this is, you can see somebody applying fake blood to this guy, right?
Are you serious?
Yeah.
Absolutely.
This was circulated online to claim that either the whole war in Ukraine was a whole hoax, or at least that some of what was being reported as happening was a hoax. Do you know where that picture's from? It's from a TV drama recorded long before the war started.
Wow.
I just want to talk about Ukraine just for 1 second, if I can, because Luca, I told you the other day that I had to look on your Twitter feed.
Oh, yes, God. How did you get it? It's private. There's a will.
There wasn't when I looked.
God, I must have done it and then did it again. Must have been hot about something.
But on there are a few videos.
Oh, yeah, with the war?
Yeah.
There's someone I know
This is
that.
incredibly irrelevant. It is so irrelevant what you're saying.
Sorry, no, what did she say there?
Right now.
I can tell you the reason.
No. We're not talking about a war. We're not using that to discredit anything this whole group
I'm not
is
trying
saying.
to discredit anything
You're
you're saying.
generalising again. We're not doing this.
No,
We're not doing this.
I'm not trying
We're
to
not
trick
talking
you.
about a war. We're talking about a vaccine here.
Why can we never get through just a discussion and then you guys can hold some of those conversations and say what you have to say?
Okay, you said you looked at my social media and you saw something about the war. This guy actually went there and he said it was like a film scene. Like they were paying actors to pretend about the war. Like propaganda.
Most of the videos posted on social media that claim to be from Ukraine are untrustworthy.
The Ukraine.
Don't know what he's on about, really. I don't see why he has any authority. He just runs a full fact, right? Which is just one of these fact-checking companies, and I think they're funded by, the elites. Like Bill and Melinda Gates Foundation. So I don't trust those guys either.
Photo is shocking, but it's an example of how easily misinformation is spread.
When we have so much misinformation, do you find that you're seeing a lot of misinformation on social media in the UK specifically to the vaccinations?
Yes, a huge amount. There are people who are very deliberately exaggerating the dangers of vaccines. And there are people who are making up these stories honestly.
When you were just speaking about it just now, you were mainly focusing on one side, whereas we just want you to keep reiterating that it's both sides so that it's an equal conversation we're having.
Let's be careful about equal, right? I mean, there is very good evidence that the vaccines are safe and effective.
It's amazing, isn't it? How it always just comes back to that. People, they just don't think. They just don't think. They just go, no, there is evidence that vaccines are safe and effective. But, I mean, in what sense? Because you don't even need them if you're under 60. So it's not that they're not safe and effective. It's like they're completely unnecessary. Like, no one's even proven that they were even necessary in the first place. And then on top of it, we seem to be seeing these adverse reactions. And some people like these two, they have had like really close people they know it happened to, so it's a lot more visceral for them. And he's just saying, no, they're effective. But I mean, he's saying it to somebody whose like friend has had one of these injuries.
But there is also very good evidence that they are also causing harm.
Some. Yeah, in some specific cases in particular. One of the most depressing
In some specific cases in particular, yes. It's like one COVID case is enough to shut down a whole city into lockdown, isn't it? But one death from the vaccine isn't enough to shut down the vaccine program. That's interesting, isn't it? How that works. There's always seems to be a push in the direction of the agenda, and then these people they call themselves fact checkers like they are critical thinkers, but they're not. They're just censorship.
Been seeing a small number of medical professionals, doctors, nurses, and legal professionals, lawyers, posting things that are provably not true. So there is a genuinely, I think, hard question about where is this balance between we should all be able to share our own ideas, but some of those things can cause real harm.
Sometimes.
Then they just use the medical misinformation argument to censor you all the time. and then that's not free speech anymore, is it? So it's either free speech or it's not.
When you fact check something, how do we know we're not just controlling someone's freedom of speech?
Like in a world where you believe in free speech, telling people they're wrong when they're wrong is the response to people being wrong.
But we're saying that they're wrong.
And fact checking is helping.
We're saying that we're saying that you're wrong. That's the thing.
I want to live in a world where everybody has the education and the information to make up their own minds.
Yeah, but that's why you're censoring it.
Really nice for me to hear that you have that moral compass, that actually freedom of speech has to still be able to be exercised, but allowing you to check those facts.
I actually learned something from this.
Sorry?
We learned something for you. Just that acknowledgement, I guess, for me, that, yeah, it's not just the anti-vaxxers, it is also...
We regularly ask the Prime Minister to correct the record when he gets things wrong.
Thank you so much, yeah.
I mean, and everyone down.
I still don't think he's got a good organisation, though, even though he might have came across all right.
Will's really got the group thinking.
Has he?
He's at last found common ground with Vicky and Nazarin. We all agree on one major point. Information is a phenomenally powerful tool. Where we disagree is on some of the facts themselves and how they should be interpreted. It's our last day, but before we head home, I want to remind everyone just how critical the vaccines have been in allowing us to go back to normal. It's a last attempt to see if anyone will change their minds. One thing that we haven't spoken about that much this week is about really the devastating impact that COVID itself has before the vaccine was around. So what I've done, I've come down to Lewisham Hospital, so this is where I had my baby. This is where Chanel's having her baby as well. But it's also the place where they treated the first patient hospitalised with COVID in London. And by now nearly 200,000 people have died with this disease. And I really want to give everyone the chance to talk to somebody who was at the very front line when it all happened. So we've come here to meet Dr. Patel. Could you give us a sense of just how hectic things were for you working here in those early days of the pandemic?
We were very busy. As you probably are aware, Lewisham Greenwich was one of the first trusts in the country to receive the first COVID patient.
When you say that they were coming in, how severe was it? Severe enough where they had to stay, or severe enough where, oh, we'll see you in emergency, go home?
No, so, so the numbers I'm talking about are those who are actually admitted into hospital.
Really?
What difference are we seeing in patients in the ICU that are vaccinated compared to those that are still unvaccinated?
We looked at about 550 patients that were admitted in our trust between the 15th of December and 15th of January 2022, which in fact would mean that most, if not all of them, were due to Omicron variant. And of that, there were unfortunately 21 patients who had to be admitted to intensive care, were the most severe patients due to COVID. Of the 21, I'm afraid 20 of them were unvaccinated. That's 95%. And
just one person?
Just one person was vaccinated. And of the 21 who were on the unit, I'm afraid, unfortunately, 7 of them didn't make it. All of them were unvaccinated, 100%. So that's one figure to just illustrate the point. Hopefully, with each passing strain, the variants will be less. However, we need to err on the side of caution, and we need to try and just make sure that we've got all the defenses possible for the next variant. And of that, there were unfortunately 21 patients who had to be admitted to intensive care, were the most severe patients due to COVID. Of the 21, I'm afraid 20 of them were vaccinated. That's 95%. And
just one person?
Just one person was vaccinated.
Right, so he's saying this thing about how everyone that we had in this, everyone who died was unvaccinated. I just don't believe that is generally true, even if it's true for this one guy in this one hospital. I just, it doesn't make sense why that would be true. Because, and then they talk about correlation, causation as a way to just rebut the conspiracy theorists, but then there's never any talk of correlation, causation when it comes to these things, is it?
And of the 21 who were on the unit, I'm afraid, unfortunately, 7 of them didn't make it. All of them were unvaccinated, 100%. So that's one figure to just illustrate the point. Hopefully, with each passing strain, the virulence...
Don't know who he is. He could be a government actor. He could well be a government actor. He could be a guy who actually just believes what he's saying, and he had a real experience. But because of that real experience, then he was asked to be in the documentary. There's so many different ways that this could be happening. It's not like, I think people just watch this and they go, oh, well, I saw there was a doctor on BBC and he said that there was a lot of COVID deaths and most of them were unvaccinated. So basically, I trust the doctor and that's it. That's not how. Is it expecting me? Are they really expecting the average unvaccinated person to watch this and like be by the end of the program be like, I wasn't convinced before, but you've convinced me now. I mean, no one's going to be convinced or unconvinced by this, are they?
Yes. However, we need to err on the side of caution, and we need to try and just make sure that we've got all the defenses possible for the next variant.
For the next variant?
When I hear stats,
It's just this assumption that these variants are just going to pop along every now and then, even though they've stopped talking about them for the last 6 months. But then as soon as they want to bring it back, it will come in the news and you'll see it. It'll be some other variant. And people just think this is just never going to end.
that. It's just, it feels like such a slam dunk. It feels like such a persuasive argument in favour of the vaccine. And
It's not. That's an emotional argument. She's all about facts and like numbers and stuff like that, but she's just had one emotional story. And then and earlier on she was saying that the anti-vaxxers get emotional and they don't use facts, but she's just getting wrapped up in that whole story about the people on the front line. And even though I think some hospitals were busy, there were a lot of hospitals that weren't. And overall, the figures weren't that bad. At least after the first spike, it was pretty normal mortality. So it certainly doesn't warrant everything that has happened over the past 2 years, does it? But they don't want to talk about that. They just want to stay in this COVID world.
I don't know if everybody else was seeing it that way.
I did find the numbers in relation to admissions, you know, and how many of them were actually unvaccinated. I guess for me, I found that a little bit alarming. So there's a lot of food for thought there.
The last 5 days have been intense. I think we all need to go home to reflect. But I want to bring the group back together one more time.
So it's been a little over 2 months since I last saw everyone. Enough time for the group really to settle in with their thoughts and work out how they feel about the vaccine. I've decided to bring everyone today to St George's Hospital, the vaccine centre here, to see if anybody, on reflection, has decided that they would, in fact, like to have the vaccine.
I don't think so.
Look at you!
Well done.
How old is he? He is a week old. Oh my gosh. Yeah, that was so good. And how's everybody?
Good.
It's lovely to see the group back together again, and I'm so happy for Chanel. I want to have a proper catch-up with them individually. I know Naomi wanted to think over everything she'd learned, so I want to find out if she feels any differently about the vaccine.
I know that you really struggled with COVID when you caught it on COVID.
Yeah.
If you could rewind in time and go back to before you caught COVID and have the jab then, would you?
That's a really good question. I think I probably would have been quite open to it.
That's so interesting. That's so interesting.
And I have been looking at long COVID and how that coincides with vaccinations.
So we are at a vaccination centre today.
Yeah.
And I have to ask, will you get vaccinated?
Now, no, but I'm not completely closed off in future. Anti-vax, I've had vaccinations in the past. I don't know. This one has really kind of freaked me out.
While Naomi is
maybe not.
unconvinced for now, she's open to the idea in the future. But Vicky's always seemed resolute in her opposition to the vaccine.
So we're at a vaccine centre, and I've got to ask, will you get the COVID vaccine?
I'm not even sure if we'd go 1 billion to 1 at this stage.
Oh, really?
No, the answer's no, though.
I think when it comes to a vaccine programme, it's not just about information, it's about so much more than that.
Yeah, I agree. There's a bigger picture.
It was unlikely that Vicky was going to change.
Information is about so much more than that.
Yeah, I agree. There's a bigger picture.
They agreed to disagree, but she said there's a bigger picture, and then the other lady went, I agree there's a bigger picture, but I don't think they agree on what the bigger picture is.
Something tells me Nazarene is going to be the same.
Will you get the vaccine?
What do you think? No, I'm not going to.
What would it take for you to change your mind?
Young people's lives, to protect those of old people, it's not ethical or moral. Especially seeing my friend who is more my age, that terrified me because that can happen to me if I choose to make this decision of getting vaccinated.
Because this is an emotional thing for you.
Of course, and both sides, I guess, have emotional stories.
For Mark, it's not about the vaccine's safety.
I'm not worried because it has been well researched and well done. It is safe. The main thing I have is you ask people if they want it, the health is up to them and it's their own bodies.
Mark and I have found plenty of common ground, but I always felt that Luca's views were the most extreme.
What do you think the vaccine's made of?
Like spike protein.
That's one change, right? Because coming into it, we were talking about
a chip.
Yeah.
So I learnt that in the house.
Yeah. Are you more cautious now about what you share online after talking to Will?
Yeah.
What?
You don't know if it's the truth or not the truth, if that makes sense. Obviously.
Oh, I'm not sure about this guy. Flip-flopping, isn't he, a bit?
When I came out of the house and stuff, I thought, oh, I won't retweet that. We don't know if it's true.
Luca has surprised me. Although he's not getting vaccinated, the shift in his views on online misinformation could have a lasting impact.
Shut up. Shut the fuck up. Fucking Hannah Fry, just shut the hell up.
Ethan was in search of the facts. I'm keen to find out now if he is any closer to getting the vaccine.
Do you want to be vaccinated?
Not right now.
Oh. Go on.
Well, never say never, because there's other vaccines out there work. I'm not a fan right now. Doesn't mean a few years, maybe.
Do you think that you found some answers?
There were some answers. I've never been against Big Pharma. If I'm against a Big Pharma and then I have paracetamol because I've got an headache, you can't pick and choose.
You can't pick and choose. You can, because you can. That's a bit of a poor argument, isn't it? You can't be against Big Pharma and then have paracetamol.
Chanel, on the other hand, came into the house with a real mistrust of the medical establishment. I want to know how she coped with her recent hospital birth.
Having to put all the trust into these medical practitioners, the doctors. I did that without fail, without worrying. Even when they was like, do you want the baby to have vitamin K? Yeah, well, if everybody else is going for it, yeah. And so that's why when it comes to this vaccine, it's not about anti, it was just about hesitancy.
It's not no, never, never.
No.
It's just not right now.
And I think that if it does go for a turn for the worst, and we've had vaccines that have been around for a little while, then I think I'd probably be a little bit stupid not to.
When you were last here,
Yeah,
I know
so the very different opinions amongst all of these people, apart from those two girls, I think, which were they were pretty. The two people that stayed home instead of going to see the vaccine maker, I think they had similar. Everyone else is a bit all over the place. It's like, yeah, maybe in the future. I've met so many nice vaccine makers that I just can't. I'm not going to say never say never, but I just don't see why people are so obsessed with these things that you inject into you. I'm not crazy about injecting something into me, and I don't want it. I don't need it. So I don't know why they want me to join their little cult. They're trying to get people on board, aren't they? It's like, oh, if you come back to the vaccine side.
Asked you if you would get involved in doing outreach. Would you consider it?
So since then, I've actually spoken to Dr. Eva. There's not a lot of people from Caribbean heritage taking the vaccine, and nobody wants to talk about these things. But I don't mind having these dialogues, because then we can figure out how to move forward,
Fair enough.
My experience has been really positive. I believe that I could be somebody that could maybe help those that not only are nervous, but then are a little bit apprehensive of people that are in the medical field as well.
I think if you tell somebody the negatives and the positives, well, then you give them that informed choice, and they can make their own mind then.
Maybe at this stage of the pandemic, it was always going to be hard to completely change people's minds.
I think I've come away from this whole experience with just a real sense of how complex this issue is, but also of how we can do better. Because I think if you want to build trust in vaccine programmes, you have to listen to people's fears. You've got to own up to the bad as well as the good. But also, I think you have to help people make sense of the misinformation.
Experts are warning that the risk is higher than ever before. And next time, engaging effectively with the millions of unvaccinated could be even more important.